Hello, and welcome to another Association of PEMF Professionals Thursday Live. I'm Dr. Jerry Dreessen. I want to welcome you to our live stream. Again, it will be recorded, so if you were seeing this outside of these hours, you can always drop us a note down at the bottom there. But of course, if you are live, we would love to interact with you as we're going through this. So, every Thursday, almost every Thursday, we like to put together a live broadcast and talk about current things that are going on in the PEMF world. Sometimes we will break it up into pieces, do segments. Those of you that have been watching this on a regular basis know that we put those all together for you. And we are currently going through kind of a mini series. Melissa, hi, Melissa. Welcome to the live. Our series that we're doing today, and I'll be talking about I went online this week and looked at the top online questions as far as does PEMF really work? And so these are what we're seeing out there on the internet. And so I'm going to roll this into what we started doing last week, which is making the science simple. So I thought what I would do today is go through some of these questions and take them on one by one and see if I can't get them answered in a way that gives you some more descriptive information or more content for things that you're saying to people, or your website or your emails or your Facebook pages, things that you can use, or those of you that are actually looking for these answers. So basically, people want to know if PEMF therapy is scientifically proven to be effective for pain relief, healing, and overall health benefits. Great question. There are, I'm now getting medical doctors in my area asking about this because they haven't seen it. It hasn't been in their world, in their microcosm. And a lot of them are not out looking for it anyways. So they're inside their group or their hospital, and just with the things that they've got going on, unless they go outside of that box, they're rarely introduced to what this is all about. Excuse me. So the questions that are often asked are, what conditions does PEMF help with? How long does it take to see results? Are there any side effects? Is there clinical research supporting PEMF therapy? And how does PEMF compare to other therapies like red light, TENS units, or ultrasound? So today what I'd like to do is to take these one at a time and go through them and see where we end up on the other side of it. So what conditions does PEMF help with? If we were to just jam it all together in a paragraph, it would be this one. That it helps with pain, inflammation, fractures, arthritis, sports injuries, post-surgical recovery. It supports nerve health, helps with migraines, depression, circulation, sleep, and energy. It may aid in wound healing, immune function, and detoxification. Research suggests that there are benefits for osteoporosis, traumatic brain injury, and chronic fatigue. Studies continue on its effectiveness. If you've done any kind of searching on the research side of it and what FDA approves it for, bladder incontinence, bone healing, regenerating the bone, also creating stem cells, which is cells that whatever cell they touch, they become. So if we put PEMF on a knee or a joint, then it'll help recreate the cells that are in that joint for faster, better repair. You've seen it in my past broadcasts where, how it heals bone faster, creates that whole system. So the conditions that you see here are, copy these down, put them on your website. Again, what'll happen by doing that is you will attract searches for people asking these questions. So it's a great way of getting some content in there. And hi, Alicia. Let me go a little bit bigger here. There we go. I don't think that's going to work. Well, we'll see. I'll see if I get my picture out of the way. I think we'll go here for now. Welcome from St. Louis. Good to have you on board. The next question is, how long does it take to see results? Results from PEMF therapy are based on the condition and the frequency of use and the individual response. So some feel relief after one session, while chronic issues may take weeks. Acute pain or injuries often improve within days, while bone healing and neurological benefits may take months of consistent use. Very interesting. In fact, I just, there we go. Just started working with a patient who she has on the front side an abdominal tear from coughing and sneezing so much, and then her mid back is in a lot of pain just from all the joints being under all of that compression. So I've actually had two pads, one large one on the back and a small one on the front. And she has a very interesting response so far. She loves PEMF. Her abdominal tear in the front is healed. It doesn't bother her anymore, but her back's still bothering her. So this is a combination of, an acute and a chronic, or a larger area and a smaller area of injury being co-treated on the same person and having these responses where she's getting fast results on the muscle tear, a little bit longer on the backside and the vertebra. So I would agree with this one as far as the varying, and you'll see it too. I have actually seen, those of you who have been watching these lives know that I talk about the guy that had his tooth pulled and his cheek was bulging out with all of the swelling. We put it right over his face. We actually watched the swelling go down while the PEMF was on it. And that was when I first got the machine. So I was just in awe watching this happen, as was the person getting it done. He was very happy because his pain and swelling went away. And then the last one is the person. So just remember, everybody has a different kind of pain tolerance. Everybody's built a little bit different. So two exact injuries in the same room may respond differently to PEMF based on who they are. Could be the water content in their body, the distribution of muscles. There's lots of other things that are going on. It's not necessarily the same thing. You're not working on cars. They're not all put together exactly the same way. So when you get in there, you pull the part, put it back in, and it's good to go. You know exactly how long it's going to take. Humans, animals, we're all different, as you know. Next question is, are there any side effects? Well, PEMF therapy is generally safe with minimal side effects. Some may experience mild fatigue, headaches, or dizziness, or temporary discomfort as the body adjusts. Rarely, sensitive individuals report increased pain before improvement. It's not recommended for those with pacemakers, pregnancy, or certain medical implants without consulting a doctor. Usually, in my experience, with anybody that I've used PEMF on, if they've had any kind of side effect, it was because of the detox that was going on. So that's why we always recommend, having a glass of water before and after, just to give your body the fluid that it needs to get a faster response. And then also drinking a glass of water afterwards. So that way you can help flush out any kind of detox that's going on. In our membership side, we talk about in your kit that you take along with you is having like a bottle of water, so that if you're going to an event or you're working with somebody and you're at a place where they don't have access to water, that you let them drink that. And that way you can reduce the amount of toxification that they can have. And Melissa, we talked about, go back in the history of our Facebook broadcast and you'll see me share about the pianist that broke her arm and we were able to shave off 4 weeks. on her care or her recovery because of PEMF. Then what do we got? Is there clinical research supporting PEMF therapy? Yes, yes, and yes. 20 years ago, there might have been just a handful. I don't know where you can go now where you don't see any kind of stuff, any kind of research. So clinical research supports PEMF therapy for pain relief, bone healing, arthritis, and inflammation. Studies show the benefits for fractures, osteoarthritis, which is there's arthritis, which is in the joints. Osteoarthritis is bone pain. So both of them help decrease inflammation, of course. Neuropathies, so those are the nerves that we have, if there's any kind of issues with that. So helping heal those, again, with injuries. And then also post-surgical recovery. And one thing that I didn't throw on here, and I should, I believe, is like burn victims. So people that have been burnt, getting that skin, that surgery, that grafting, getting that to take on and heal faster. Research also explores its effects on brain health, circulation, and sleep, while promising more large-scale studies are needed to confirm long-term efficacy. So you have, well, the long-term is going to start to come out because we're looking at, at least 10, 15 years that some of these studies have started with. So we'll start seeing some long-term results, which is great. The other thing that I wanted to talk about on this, in fact, it was last night, I was going through some of the latest PEMF research that's out there, and we just might see this. It was done in Asia, where people are seeing a reduction of fat by using PEMF. I think it's because the PEMF gets in there and starts energizing the body and getting the mitochondria to start functioning. Of course, the muscles begin to twitch and contract. So they did a placebo system where they had people get up and walk around and do deep knee bends. And this one group had PEMF and this other didn't. And the people with PEMF had a drop in their overall percentage of fat. So I'm waiting. It was published, but I think it needs to be done again and proven. So, but I'm just throwing that one out there. So you might see, I don't know, maybe in the next 5 years, we might see PEMF being used as a type of non-drug weight loss product. So you heard it here first, folks, or I'll be the first one that they skewer, roast over the fire for even saying it. But you can go out there and you can do a search on it too. I might even drop it in the comments. And then finally, how does PEMF compare to other therapies like red light, TENS, or ultrasound? So just know that PEMF penetrates deeper. That's really the main thing. Red light is a light that shines on the skin, on the surface, and then decreases with distance or bone. So like a person presented it like if you are in a cave or you're standing outside a cave with a flashlight and you're shining it in the cave. If there's a rock that's there and you shine the light, the light's not going to go past the rock. It's going to block the light and not be able to see it on the other side, which is red light. And again, it only goes a certain depth. And ultrasound, same thing. It gets blocked by bone, denser tissues. And they all target cellular function and inflammation, which is great. Red light aids in skin and tissue healing. TENS units block pain signals. That's really all it is. It's an electrical stimulation that overrides your body's sensation of recognizing pain. And then ultrasound promotes circulation. So PEMF offers broader benefits for pain, recovery, and bone healing, while other therapies focus on surface level or nerve-based relief. Again, PEMF travels all the way through. But it decreases the amount as the further away from where it starts. So the origin of the PEMF. So whatever you're using, a pad or a loop or a large pad from that spot, as it goes out, it decreases in its strength, but there's nothing that stops it. There isn't anything that, like a bone would or a muscle would. It goes through all of that, which is what's really cool about it. Just like, we get our frequency that we're in here with the Earth's magnetic field, it penetrates our body. It's all part of our system. So those are the top questions that I found. What does PEMF help with? What conditions? How long does it take to see results? Are there any side effects? Is there clinical research supporting PEMF therapy? And how does PEMF compare to other therapies like red light, TENS, and ultrasound? So that is winding down here on today's live broadcast. And I want to thank you for being part of this. And our goal at making the science simple on PEMF. And for those of you that are joining us for the first time, we are a professional organization designed to help professionals with our whole system that we have. If you found this of interest and you liked it, jump over to LinkedIn and like it, jump over to Instagram and like it, jump over to YouTube and like it. Kathy, you're welcome, Kathy. And again, part of this is learning the science, but also how to speak it in terms that can be understood. So we're not babbling like a bunch of PEMF geeks, which we are. Those of you that have them know what I'm talking about. But also we have a blog on our website too. Speaking of our Facebook page, we also have what you're watching now, but also our membership site we have. And you can jump over there, members only. You can ask questions in there as well. Melissa, yep, you're welcome. You're welcome. I'm glad you appreciate this. That's another thing too, just feedback on our lives, what we're doing. We like to create these things based on your interest as well. On our website, we've got a code of ethics, who we are, what we're all about, anything about PEMF and what is the truth behind it. Trying to get rid of, back in the day, there was a lot of stuff that was out there. People making claims, things like that. So we're all about, here's what's going on. It's in the science. So that's the main thing too. And again, our website, www.pemfprofessionals.com. Would love to have you become a member where you get certified in human, animal, large or small, and red light therapy, also with basics, where you can take this into your business and use it. You can promote yourself by becoming certified. You can go on our website and get these not only certifications, but this is a metal sticker. Like you can stick it on anything that you're promoting, on your car, those kinds of things, on your bags. Don't put them on your animals because they don't stick very well. Questions and tips, you can jump on and get a hold of us, info@pemfprofessionals.com. We were more than happy to answer any of your questions. Again, part of the certification is also helping you promote yourself. So we're really big on helping you get your business up and off the ground too. So we've got plenty of stuff on the membership side that talks about marketing, things like that. So with that, I want to thank you again for hopping on and being a part of this. Those of you that jumped on live, thank you for helping out today by adding your information, and would love to hear more from you in our membership side. So feel free to jump in there too. I will end today's live stream, but again, it is being recorded, so you'll be able to access it again after it's over with and forward it to your friends that are interested in PEMF. So with that, thank you. I'm going to date this video just to let you know that in 2 days, we've got Valentine's Day. So make sure you are taking care of things, if you know what I mean. Oh, Sheena, hi. Welcome. It's okay to be late because we've got recordings. Okay. So with that, have a great day, and we'll see you next week. Take care, everybody.